My parents are from the state of Guanajuato and the city of León. They came to the United States about 37 years ago in order to give both my sister and I a chance at the American dream. My mom was diagnosed with breast cancer during my sophomore year in college, and so that made me reevaluate my life, where I was headed to, and what my life meant at that moment.
This is Carla, a woman hoping for a better future for her family.
I think in realizing her obstacles and seeing what she went through made me realize that I was the middleman between the surgeon, my mom. I could have that first-hand impact with the patient and with the Hispanic population.
Que ella se enfocó, cambió su carrera de accounting a médico. Me siento muy orgullosa de que debido a esa circunstancia de cáncer, mi hija se inspiró en curar a otras personas.
Only 6% of physicians are Hispanic, and even less that speak Spanish, so I think that being able to bridge that gap will leave a far more palpable impact for humanity. As a little girl, I was a former patient at 16th Street Community Health Centers. It's a community clinic that offers primary care services predominantly for the Hispanic population. I was doing research with MCW, and one of the opportunities that came about was to be an ophthalmology scribe for Dr. Jane Carla's skiers. Where I was a former patient, now I'm scribing and I'm interacting with the Hispanic population and the Hispanic community.
Carla's young, inspired, wants to do a lot of good work. It's really clear that she's very invested in health of the community. That's what the All of Us Project is trying to do.
All of Us is a nationwide research program that's trying to have 1 million people participate in order to have a biodata bank of genetic information so that doctors and researchers can ultimately make medicine that's more precise.
So a lot of the biomedical research that's been done historically in the United States has been on middle-aged white men. There are examples where a drug is developed for the normative white male population, and that doesn't work particularly well for women, or in certain cases for certain ethnic minorities. We're really trying to say for this person, what's the best medication based on their genetic profile.
I'm able to speak with Hispanic populations and speak to them in Spanish and bring them to the forefront to say, please participate in research and please make your voice and your concerns heard.
One of the things that MCW, I think, is doing extremely well is thinking about how do we take these young professionals who see an unbounded possibility set and provide them with the specific skills, the context, that's going to turn them into a really well-rounded healthcare professional.
It has not always been easy, but at the same time it's built resilience into me. I think that I've used that as an asset for what I want to do next.
Ella ha aprendido muchísimo y es muy inteligente, muy entusiasta en lo que ella quiere ser, muy dedicada a su trabajo. Me siento muy orgullosa de ella.